My name is Mary Joy Garcia Dia, and I am the current president of the Philippine Nurses Association of America. The year 2020 is something that we will always remember. We were called as superheroes. This recognition still resonates to many of us until now. We know that recognition fuels our soul. It affirms our deep commitment in nursing, and at the same time, it shows the contribution that we do not only with our profession but also in society in general. Within our organization, PNAA recognizes our nurses through our Nurse Excellence Awards every year. We recognize members who have excelled in their clinical specialty in nursing research, education, administration, community and population health, entrepreneurship, nursing informatics, and advanced practice. For many of us, we do our work quietly, especially for those that volunteer in the community. We know the significance of that work that you do in providing blood pressure checks, glucose and cholesterol checks to many underserved population. This simple task may seem ordinary from your end, but it means a lot to people that cannot afford health insurance or does not have the means to see a doctor. We also know that during the pandemic, many of you, especially in your chapters, have volunteered in sewing face masks and even purchasing surgical masks and face shields, delivering this to essential workers, nursing homes, and even back home in the Philippines. Some of you even volunteered and provided food and also delivered face masks to homeless shelters. So I am excited that with the DAISY Foundation, we are partnering in providing the first inaugural DAISY Advancing Health Equity Team Award during our national convention in July 2021. I am so honored and pleased to introduce Bonnie Barnes, co-founder and Chief Executive Officer of the DAISY Foundation.
Thank you, Mary Joy. What a delight to share this video message with you and to help PNA launch the DAISY Award for Extraordinary Nurses Advancing Health Equity. I hope most of you who are watching this video are somewhat familiar with the DAISY Foundation. It's now 21 years ago that we started DAISY in memory of extraordinary care that our Patrick received when he was in the hospital for 8 weeks. And when Patrick died, we were so touched by the care of his nurses throughout those worst weeks of our lives that we felt compelled to say thank you. Thank you to nurses not only for the clinical excellence you demonstrate every day, but especially for the little things you do, for the compassion and kindness and sensitivity you show not only to your patients, but to their families as well. We know we were on the receiving end of just that kind of care, and we will never stop saying thank you for what you all do every day. Well, the DAISY Award now is honoring nurses in over 4,700 healthcare facilities and schools of nursing all over the U.S. and in 28 other countries, including the Philippines. And we're very proud of the fact that more than 2 million times a patient, a family member, or a coworker has taken the time to share their story of the impact that a nurse has had on their care and on their lives. Well, what are we doing with advancing health equity? I'll tell you why this is so important to us. As we sat last summer watching the horrors that went on around the murder of George Floyd, my husband Mark and I felt very strongly that DAISY had to do something. We had to find some way to support nurses in the work we know you all do every day in the community for people who are suffering from social determinants of health through no fault of their own. We wanted a way to support you in that valiant work, and we felt the best way to do it was through what we do best, and that's with nurse recognition. So we created a rendition, if you will, of the DAISY Award to really honor those nurses and nurse-led teams that are doing great work in the community advancing health equity. Well, how wonderful that our partners at PNAA suggested that they would like to have an award just like this where their chapters could could serve up teams that are doing incredible work and could be added to the award program that PNAA already does so beautifully. Well, of course, when this was suggested to us, we were thrilled. And here we are, ready to announce this program that's kicking off over the next couple of months. We are also very privileged that Charismatic Brands is supporting all of the work we're doing in health equity here at DAISY, including a grant program that we've started for nurses who are doing research and evidence-based practice projects to help offset social determinants of health in the treatment of patients and their families. So thank you to Charismatic Brands, who are the makers of Cherokee scrubs and so many other wonderful medical uniforms. I also want to tell you how excited we are that we will get to see in just a few months at your annual meeting who is receiving the first DAISY Awards at PNAA. So what I'm going to ask you is to make sure you all now submit nominations, because I can't wait to read the stories of the very, very special care you're all providing in the community. Thank you so much for everything you do every day. Thank you for taking the time to write those nominations. We're really excited to partner with PNAA on this very special program. So long. We'll see you at the conference.